At this time, I want to give one more concluding thought. So one of the things that I've been very concerned about through reading about long COVID and the effects of SARS-CoV-2 is the effect that this virus is having on the frontal lobes. And this, I think, is a very disturbing thought. This can result in great disruptions and havoc with our society. An article which was published in the Journal of Alzheimer's Disease reported that there are numerous studies finding that SARS-CoV-2, the virus which causes COVID-19, commonly attacks the frontal lobes. Patients experience behavioral and executive dysfunction. Now, the core areas of executive function include working memory, staying on task, cognitive flexibility, and self-control and emotional regulation. Now, this problem has been documented in multiple studies, and abnormalities in the frontal lobes have been seen on both EEG recordings, MRI, and PET scan imaging. Now, a report published in Cortex also stresses that executive dysfunction can occur with frontal lobe lesions. This report states that a variety of emotional social disturbances can occur with lesions in the frontal lobe, manifesting by irritability, impatience, lability, resulting in difficulty in controlling socially appropriate behavior. Brain and Cortex had a report finding that prefrontal cortex is important in decision-making and modulates antisocial behavior and reactive aggression. In other words, if you hear something you do not agree with, one may respond in an overly aggressive, inappropriate way and not be able to consider the other person's point of view. I, for one, strongly believe that this is what's happening in our society. Now, this doesn't need to happen in everybody, maybe only in a few people, but it only takes a few people to be major disruptors of our society and of how we deal with problems in our society. So I feel that the lack of civility, the unwillingness to consider other people's points of view, along with an increase in violent behavior, could be explained by anatomical frontal lobe damage caused by SARS-CoV-2 infections. So that's a concluding thought for you all to consider. We will conclude our conference. We will try to have one next year. I would like to thank Dr. Elders for giving some really good words of wisdom that no matter how old we are, we can go out and fight for public health, and we can fight for promotion of vaccines, trying to stamp out pandemics, because we need to get control of the COVID-19 pandemic, but we also need to not get other pandemics that we've already conquered to have them come back because people are becoming vaccine hesitant.
Negligent.
Yes. So at this time, let's conclude the webinar, and we'll hope to see you all next year. Thank you all very much for attending.